Hey everybody, it's Chris Kresser. Welcome to another episode of Revolution Health Radio. Today I'm really excited to welcome Dr. Steven Lin as a guest on the show. He's a dentist, and we're going to talk about the connection between diet and dental health and the connection between dental health and overall health. I've come to believe over the years that dental health, and in particular the structure of our face and jaw, is one of the missing elements in the functional approach to health. We talk a lot about diet, exercise, stress, physical activity, sleep, etc., as mechanisms that can drive disease. We also talk about things like SIBO or infections or toxins or nutrient deficiencies as mechanisms that can drive disease. But dental problems and misaligned structure of the jaw, malocclusion, etc., is also a significant driver of disease and one of the primary areas of mismatch between our modern diet and lifestyle and our genes and our biology. So we're going to talk all about this and talk about some things that you can do about it. So it's a whole nother lever for intervention and improving our health. And I'm really excited to be talking with Steven Lin about it. He's a board-registered dentist, a TEDx speaker, and author of the new book, The Dental Diet, which we're going to talk about as well. Dr. Lin was trained at the University of Sydney with a background in biomedical science. He's a passionate whole health advocate focusing on the functional link between nutrition and dental health. His mission is to prevent dental diseases, including orthodontic braces, and to reshape the model of dental practice. So his book, The Dental Diet, is coming out today. So we're really glad to have him. And it's a journey through ancestral medicine, the human microbiome, and it models how crooked teeth is an epigenetic nutritional deficiency and presents a plan to heal your mouth, your body, and your mind. So without further ado, let's dive in. Dr. Lin, thanks so much for joining us.
Hey, Chris, such a pleasure. Thanks for having me.
Yeah, so we originally met at PaleoFX. Was that last year or maybe a couple of years ago?
Yeah, it feels like a long time ago, right? No, it was last year, and that time's just absolutely flown. No, you're right.
Yeah, I'm already planning for the next one. I just sent in my proposal for the talk next time. Are you going to be back?
Yeah, I'll definitely be there, and I really enjoyed seeing, that was such an inspiring time, to actually see your work in person. And, it really kind of, the stuff that's happened since then, it's really kind of snowballed. It's been such an amazing experience.
Cool. Yeah. So, you approached me which I'm really glad you did, and chatted with me a little bit about the importance of dental health in overall health, and then, of course, the importance of food and diet in dental health, which, of course, most people who are listening to this show are like, yeah, but that's actually fairly controversial in your world, isn't it, as a dentist?
Yeah, it makes complete sense, right? You think the mouth and food, right? It seems so silly that we would ever see those two things disconnected. But the two concepts do not link at all in what conventional dentists are taught, or what we, how we look at the mouth and how we treat the mouth, or how we prevent disease. And that's the big one, is that we are not preventing diseases because we are not understanding the nutritional mechanisms of dental disease.
Right. So the idea is kind of if someone has dental problems, they're just not keeping up with their dental hygiene, right?
That's exactly right. And it's one of, the core piece of information that dentists give out is that we need to brush, floss, and, use mouthwash, or, disinfect our mouth. And, the way I kind of see that is like, do you take your car with an engine problem to the car wash?
Right.
You got to get under the bonnet, right?
Of course, there's also the question of, like, when we dig up archaeological remains from 30,000 years ago, these people have perfect teeth. And we can be pretty sure that they weren't using, dental floss and toothbrushes at that point.
Yeah, dental floss and toothbrushes, haven't only been around for decades. And this was really one of the awakening moments for myself, and to kind of see how limited my training was that when you look at the archaeological records of dental disease, it doesn't exist in any biological system, beyond when we hit the agricultural revolution and then the industrial revolution. And so animals, ancestral cultures, dental disease doesn't exist because, in nature, if you have a problem with your teeth, you have a huge issue. You're not going to survive. And so we need those systems to be working in order to be a biologically functional organism.
This is why I love the evolutionary perspective, of course. It's just absolutely common sense for the reason that you said. If an animal doesn't have a functional dental architecture and teeth, they're not going to survive in the natural world. And so it makes no sense at all that a human being would depend entirely. I'm not saying there isn't a role for brushing teeth and flossing, and I imagine you're not either, but to depend entirely on that for dental health makes no sense from an evolutionary perspective. And even now, I think the only animals that experience dental problems are our pets, because we're feeding them the wrong thing too.
That's exactly right. And there are studies actually that for zoo animals, for instance, in cheetahs, they've noticed palatal dysfunction. And so the only time you see malocclusion and crooked teeth is when we feed them the processed diet. Go figure. Exactly. And so the ancestral perspective was just such a waking moment, plugging that back in. Because I was always kind of an evolutionary biology nerd before I went into dental school. And I expected that. I remember actually from my dental interview, I wanted to talk about impacted wisdom teeth and, how that's, is that a sign of that we're evolving, away from, are we seeing that, will we eventually lose our wisdom teeth? But that was never covered in my training at all. We never talked about jaw development or, what ancestrally we've seen in terms of our dental health. But wisdom teeth impactions, it's almost, we see it as absolute common sense now that we go and rip these teeth out of our jaws because, that they don't grow properly. And no one's questioned that. There's no attempt to say why wisdom teeth impactions are so common today.
Yeah, I mean, it's the ancestral evolutionary perspective is lacking across the board in medicine, but it does seem to me that in dentistry is one of the areas where it is most needed and also most lacking. Like there's virtually no discussion of it, I think, in conventional dentistry, whereas in conventional medicine, there is some discussion of evolutionary medicine. There's even that term, evolutionary medicine, and I'm seeing articles in the New York Times about the Tsimane in Bolivia and question about why don't they have heart disease, at the same rates that we do? Why don't they get Alzheimer's? So I see that a little bit with health. Is there any discussion of that at all in dentistry at this point in the conventional world?
In the conventional world, it is still quite disconnected. But in the early 20th century, a lot of the literature was based around, for instance, the orthodontic industry, the early textbooks, Henry Angle and whatnot. They talked about craniofacial growth, and they spoke to anthropologists. And so Robert Corricini is one of the most prominent dental anthropologists. And so he's done hundreds of studies looking at teeth across all kinds of different situations. And his sum up of what his life's work showed him is that malocclusion is the malady of civilization. And you talk to any anthropologist about dental health. And the funny thing is that the records we have about our human ancestors is all based in jaws and teeth. So how are we not connected? We give them a dental exam. It's so crazy it's been disconnected.
Yeah.
And anthropologists will laugh at you when you ask them about dental health in societies of years gone by. It just doesn't happen.
Right. Yeah, it seems like the most obvious question that anyone would ask if they're digging up these remains. Like, oh wow, these people all have perfect teeth. How is that possible in a lack of all modern dental hygiene? Of course, there's Weston A. Price, who did ask that question. He was working in the 1930s, 20s, 30s, and wondered why people in the industrialized world all seem to have screwed up, crooked teeth, and took off on a worldwide journey to answer that question. So tell us, I've talked about Weston Price and written about him extensively, but I think some of my newer listeners may not be familiar with his story, and it's really revealing, I think.
Yeah, and this is actually revealing for me as well. It was actually, kind of the catalyst to start this whole journey is that, I was in dental practice seeing very sick kids coming and, whose jaws weren't developing, who had this host of chronic diseases that I could not explain. All I could do was fix their teeth, and I was becoming disillusioned with my work. So I actually took time away from my practice, and I was actually in Europe taking some backpacking time, and I was in a hostel in Istanbul, And on that shelf was it was a shared reading shelf where you leave your book and go on your ways. And there was this book called Nutrition and Physical Degeneration. And so I didn't know what that was. In my 7 years of practice, I had not heard of Weston A. Price. And so I picked it up and I was like, what is this? You don't normally see dental books on the textbook,
Right.
on any shelf, right?
Yeah.
But I opened it and it was a completely different language to me. I did not understand or comprehend what this book was about from a very casual perusing it. And so I looked at it and I kind of, it's got 15,000 photographs and I kind of discounted it. But I came back to it probably a few years later and went into a deep dive. And the story of Weston A. Price is just fascinating. He was a dentist from Cleveland, Ohio, who practiced in the early 20th century. And he thought that his patients were looking much sicker than what he'd seen in his previous years of practice. So he had a theory that the modern diet was the cause. And so, as you said, he went all around the world to 14 cultures and he studied this interception between the modern and the traditional diet. So he found the cultures that were living on the traditional means and also were living close by to people that had access to modern foods like refined sugars, flours, and vegetable oils. And so what he did is he compared the dental health of both of these populations in all of these places, took photographs, looked at the ancestral records, and he showed that in every time when the modern diet intercepts, that's when modern dental disease appears. And this is in the 1930s, so we're only talking about not less than 100 years ago. And if you look at Price's work, a quick Google search will show all these faces in black and white photos, and you see these amazing wide dental arches. Now, when I saw that, my mind said, that doesn't happen. I don't see that in practice today. Kids do not develop dental arches like that anymore.
Oh.
And so I thought this must be, some kind of, old book that's obviously outdated. But I realized then that there is something missing here, and the Price was speaking about something vitally, vitally important, and that all of a sudden it awoke me, and we are in an epidemic of crooked teeth and malocclusion. And so the orthodontia today, 4 million kids have braces in the US. No one has tried to find out why that is. And so all we're doing is straightening teeth without trying to find the cause of this. And we've walked ourselves into a craniofacial structure that is not developing anymore. And this is what Price was talking about. I think it's one of the most important health books that has been completely misunderstood. And you've really helped to bring his work to a better understanding. But I think the problem is that the dental industry really has misunderstood what Price's message was. And kind of Price was a bit of a victim of his time, which most scientific innovators are.
Yes.
He didn't have he couldn't identify activator X. So he was identifying 3 factors in the diet, vitamin A, vitamin D, and activator X, that when every traditional side made sure they had that 10 to 20 times as much in their foods. And so when he said, when they eat these 3 vitamins, their faces grow well. And that's as simple as he put it.
Yeah.
But now we've got the science to plug in exactly what's happening there. We know craniofacial growth is related to our facial structures and why that relates to, for instance, airways and what's happened since. And we can now intervene in that process. But the nutritional plugging in and the K2 story, I think, is really kind of, so he called activator X as that other key factor. He died before he identified it, vitamin K2. And I think that was probably one of the key factors that would result in his work being lost for 60 to 70 years.
Yeah, I agree. I mean, the amazing thing about his work in that book is that you don't see these changes happening over, 100 years when people switch from a traditional diet to a modern diet. You see them in a single generation. I mean, and he even has pictures of people living and following their traditional diet and lifestyle, and then the next generation that has, moved and started to adopt a Western diet, and you can see their facial structure is different. They had nice wide dental arch and straight teeth and, prominent chin that's not totally lower jaw that's not totally recessed. And then in one generation after the modern diet, the face is narrowed, dental arch is narrowed, the jaw is recessed, and the teeth are crooked. And, there's tons of gaps in space. It's really remarkable that it happens that quickly.
It's absolutely, it's quite frightening, really. And the fact that we've lost, I think it kind of speaks to, we're kind of a species with amnesia that's forgotten how to eat. in terms of how to develop a dental arch. It's such a fundamental part of our physiology that how could we have forgotten this such important information.
Yeah, and it's really something. What's interesting to me is that still to this day, I mean, even as you say, we understand that vitamin K2 is activator X. We understand the role of fat-soluble vitamins in growth and development of the jaw and other skeletal structures. It's still not on the radar for most people. Like I was just at we have a 6-year-old daughter, and she was in a musical theater performance this weekend, and I went to the performance, and I'm watching the performance, but me being me, I'm also just watching other stuff. And I happened to notice, like, I would say at least 50% of the kids just had totally crooked teeth, narrow faces, recessed lower jaw. It was such clear evidence of malocclusion and impaired development, of the facial structure. And I'd like to get into what that means from a health perspective, because it's more than just crooked teeth. But I would venture to say that if we ask those parents, number one, do you see anything unusual here, abnormal? Oftentimes the answer is going to be no. Like they're not even aware that is unusual or abnormal. It's not unusual. It is abnormal, right? They're not aware that that's not normal part of human development because so many kids have that. We've just come to accept it as normal. And number two, if we ask them, is there anything you could do differently? Or, I mean, and this, of course, is a little more challenging or difficult of a question because it implies some guilt or blame sometimes on the parents, which I don't, it's just lack of awareness. But is there anything that actually contributed to this? 90% of them, 95% of them are not going to say that it's diet, or lifestyle related. They'll probably assume it's genetic or something like that.
That's completely the problem at hand. And, this happens in the dental practice every day. We see kids come in with these craniofacial structures. And the way I would describe it is that my training did not allow me to identify that this was a problem with craniofacial growth. We would identify the teeth. So we would just look at the teeth, their relation in the jaws. So there's 3 classes of malocclusion: class 1, class 2, class 3 angles classes. That's what we learned about. So the kid would come and sit down, open up and look at the relation of the teeth and the bite. And we'd say, well, you've got a bit of crowding there. You might need braces in the future. And a really uncomfortable moment in the dental practice was when parents would ask me, why is this happening? Why does this child need braces? Maybe this one, maybe not. And it would always kind of be like, well, it's genetic.
Luck of the draw.
Exactly. Yeah, exactly. And like that's what I was taught, but there is no genetic evidence that line of thinking has not played out in the literature whatsoever. We cannot explain craniofacial growth as a genetic problem and the vast epidemic that we're in today. But these kids are showing far more symptoms than just jaw growth. They show a very fundamental pattern of how they look as a person. And the face is a very powerful aspect of who we are. And so they're coming into the surgery, they're slumped over, their shoulders are slumped forward, their head's postured forward, they have dark circles under the eyes, their mouth is open, their tongue's hanging out of their mouth. Their mother says they don't sleep very well, they don't perform very well at school, they act up, they often have digestive issues. And what we see is we've got this tiny, tiny, long, underdeveloped maxilla, which is the upper jawbone. And so the way you see that is that's the palate. So the roof of your mouth should be flat and wide and U-shaped. In these kids, today I'm seeing, it's like V-shaped and very, very high. So you can nearly barely fit your finger up to touch the palate, and that should be flat. And so that's a sign of a skinny and underdeveloped maxilla. And so what's happening in that, when that palate is underdeveloped, that higher palate is actually impinging on the nasal airways. So their nasal airways are completely deformed. Now, that was never taught to us in dental school, that the maxilla also actually houses the nasal airways. And so crooked upper teeth are a direct sign that we have a decreased volume in the airway system. And so that goes to explain why, for instance, when they sleep, they have to sleep with their mouth open.
Right.
It increases the pressure, and they're actually going through forms of sleep apnea and breathing issues when they sleep. And so they're having very, very dysfunctional and non-restful sleep, very unlikely getting into the late stages of REM. And that's why we're seeing the deep connection between these kids with breathing issues and ADHD, which we know 10% of kids are now on ADHD medicine. A lot of the time it is a breathing issue. And so there are a plethora of problems here that we're missing.
So let me just stop and reiterate some of this, because I think it's really important. I think awareness of this is very low, even in the world of people who are listening to the show, functional medicine, integrative medicine. Dental health is about much more than how your teeth look cosmetically, or even things like, the health of your gums and your oral microbiome and how that contributes to other health issues, which we've talked a little bit about before. You're saying that the structure of your jaw and how your jaw develops can affect everything from sleep, which, as we know, then affects everything else. Poor sleep is one of the primary drivers of all chronic diseases. It can affect your nervous system. It can affect your immune system. It can affect, and I'm putting some words in your mouth here, but you summarized a lot of different conditions. Your endocrine system and hormone production. It sounds like it virtually affects every system of the body. Would you agree with that?
Absolutely. And this is what we've vastly missed, is that crooked teeth are a sign that these fundamental processes aren't developing properly. When we don't develop a craniofacial structure, so the maxilla and the mandible, which is the upper and lower jaw, they form the structure. And so the bite, how our teeth come together, will actually impact our spinal posture. So how the maxilla and mandible posture together, the entire spine will have to adjust. And so, for instance, a lot of kids have that forward head posture and the reason why they're tipping their head forward is because they need to open their airways. So this is a purely survival instinct, is that, we have lost these wide open nasal sinuses that we need to breathe through. And then so we have a skeletal structure that's adjusting. So malocclusion is just adjustment to the environment. And so, we're using the input that we have to create a structure with the resources that we have. But so
it's a maladaptation.
Exactly. And you've summarized it perfectly there. It rolls exactly onto all these different structures. It's at the root cause of all of these issues. If you're breathing in craniofacial structure and brain is in a system that's kind of cramped, and there's one description of it, a tiger being stuck in a cage. You were basically stuck in these airway structures that are just causing us extreme deep autonomic problems. Yeah. And so the breathing connection is something that we were never connected to, but also the intervention of how, for instance, the tongue drives facial development. So the maxilla is the centerpiece of jaw growth. And so how the tongue and oral posture and breathing all come into this lovely interplay of functional craniofacial growth.
I have some personal experiences with all of this that I want to talk a little bit about, just to kind of bring this to life for people. So my wife had chronic intractable upper back, neck, and shoulder pain for probably 20 years. And she is a longtime meditator. And when she would do meditation retreats, it would just be pure agony, because she'd be sitting there in meditation posture for 14 hours a day in a position that was just agonizing for her to be in. And she is someone who has a very high level of body awareness. She's a Feldenkrais practitioner. She's trained in somatic experiencing. She's a dancer. She's someone who has spent, many, many years cultivating body awareness. So this pain was not something that was unexplored, or, she had tried everything that you could possibly imagine to resolve the pain. And then, we began to learn about this connection between the structure of the jaw and all of the rest of the systems of the body several years ago. And she went to work with a dentist who does what he calls dental orthopedics. I think you call it functional orthodontics. Steven, we'll talk about this in a little bit, but basically he works with patients to realign their jaw in a way that's more consistent with our, evolutionary template, the norm. And so he gave her a dental appliance that did this, and immediately, overnight, her 20 years of intractable neck and shoulder pain disappeared. It was just gone. So then, later on, I think a couple of years ago, I was starting to get sick a lot during the winter. And at first I thought, what's going on here? Is this because I have a daughter who's in preschool, and just bringing home all these germs? But it was beyond what seemed normal, even considering that. And I have a very narrow face. I'm the classic kind of poster child for this maladaption and the mismatch between our modern diet and lifestyle and what our genes and biology require for proper facial development, jaw development. I have a very narrow face, narrow dental arch. I actually had 4 adult teeth extracted, which was horrible. I can't believe they were doing that still, but that made my jaw even narrower and narrowed the space in my dental cavity. I don't have that wide roof of the mouth that you were talking about. I have a narrow one, which creates even less space inside my mouth. My tongue frenulum was very tight, so I didn't have that. I was you just go down the list, and I had all the things wrong. And I started to work with a dental appliance, and as soon as I put it in, it made my bite tip to tip, which is what Price observed in all of the people that he studied. And that next winter, I didn't get sick once. And since then, I haven't really even been sick. I've had, it starts to come on, and I take my herbs and stuff, and it goes away, generally within a day. And I haven't really even been fully sick with a cold or a flu since I had this appliance. And now, our daughter, Sylvie, she has, straight teeth. She doesn't have a lot of dental problems like many kids do, probably because of her diet. But that wasn't able to overcome both my wife and my issues, which we of course passed on to her. So she's starting to work with a dentist who is, very skilled with the functional orthodontics or dental orthopedics, and it's having quite a big impact on her nervous system, on, behavioral patterns that most parents would assume are just part of personality or maybe even related to diet, but that in many kids' cases, I think are directly related to the structure of their jaw. So that's just to give you an idea of the breadth of conditions, people who are listening that correcting these problems can address, and that this is really a whole another avenue of approaching health problems from a functional perspective. We talk about diet, we talk about sleep, we talk about mechanisms like SIBO or nutrient deficiency or infections or toxins like mercury or mold. But I would say that the structure of the jaw and, dental health certainly in general, but more specifically, the structure of the jaw is another core fundamental mechanism that we can use as practitioners or as people to address chronic health problems.
Chris, it's so true. And, you've actually summarized it amazingly well there in terms of, the potential out there. And the big thing here is that for most people, what we see as the conventional orthodontic approach is that when a child goes to the orthodontist, they'll be told, well, we're going to wait until those adult teeth set in and then we'll put braces on. And so that approach is completely disregarding that there is a developmental process that we can intervene in. And what they're often doing, as I think you experience, is that they're extracting teeth when there's not enough space. So you've got a malformed system. They're taking the teeth out, and then they're straightening the teeth in the malformed system. Now, the way I would describe a professor that I work with that I think describes it very well is when you build a house, you don't put the furniture down and then build the walls and the roof and the tiling around it. First you put the foundations, then you build the walls and the roof, and then you put the furniture in. So using braces to straighten teeth is like putting the furniture in. The teeth are the last adaptation to a whole system that has grown and developed in a certain way. And all the other issues are going to be underlying if we don't address that. So we've been veneering over this completely poorly, and basically a system screaming out for both function and the nutrients it needs to grow and develop properly. And the amazing thing, as you've said too, is that I wasn't taught in dental school that in the palate that we have stem cells up across the midline of our palate, so the two sides of the maxillar fuse. That was never taught. We were told it fuses, roughly in your teenage years, and that's it, you're done. But so when you send physical messages via these expansion devices, these stem cells wake up epigenetically, and then suddenly they begin to build bone. So you can expand. It's very slow in adults, but the clinical applications of this are really, really exciting. And I've seen, for instance, we've used brain surgery software to track how a 6-month expansion process will impact the whole system. And so what you see is remodeling on the underdeveloped area of the maxilla, but even when you don't expand the other bones, the mandible also remodels on its own. So it's taking messages from the muscles that are readjusting. But then you see the eyes level up. So they'll actually, the orbits will actually develop and level out because their maxilla has expanded. But the really amazing thing is what we're seeing is that the sphenoid bone, which sits right under behind, and which is the base of the brain, is remodeling as well. So that expansion is having profound impact. And I think this is one of the most important things we need to do is to understand this system and get this very, very simple. Like you said, you put the device in and you felt it straight away. Mm-hmm. This is such a simple intervention, but once we understand that we can, how important this is, and that we can actually have an impact on this, the implications are potentially enormous.
It's amazing the changes you can see visual just with your own eyes with kids who wear these devices that correct these problems. You actually see their faces widen, you see their teeth change, you see the whole structure of their face change. It's very visible. I've seen before and after pictures in many kids who've done this, and even in adults. You can see adults' faces change too. As you said, it's slower than it is with kids, but I've seen pictures before and after pictures of adults that in some cases where certainly you can still recognize them, but it's extremely notable, especially when you put the pictures side by side. So Steven, there are a lot of different ways that people go about doing this kind of work. And I know now people are listening to this, they're going to be curious and they're going to want to know, how do I find someone who does this kind of work? Like, what should I be looking for? And, we're still talking about the functional orthodontics, dental orthopedics here, and I want to come back to some of the other topics regarding dental health, but there's ALF, is one way that, one kind of methodology for correcting the problems with the jaw. And there are a bunch of other techniques. It kind of seems like the Wild West to me still, that there's not really any standard technique. And you have dentists who have their own kind of personal approach to it. And it makes it hard for me, at least as a practitioner, to refer people to somebody because it's hard to know who's doing good work.
That's the challenge at the moment. We have so many dentists, and I visit them all over the world, that are doing such great work in this area. And and like you say, it's a very individualized. People have kind of taken their own spin on things and used kind of different research and created different devices. The ALF is one expansion device, so that's a non-plate bonded upper maxilla device that you wear that expands. So that's one system. So all that does is expand in the way that we've spoken about. It's very simple. You get good results with that. There are other systems, the DNA appliance, the BioBlock, so orthotropics, which is the UK system by Mike and John Mew. So they use what's called orthotropics, and it's kind of, there's a lot of different names, like you said, orthopedics. It's called all these different names. So
yeah, the DNA appliance specifically claims to promote stem cell generation in the mouth, I think.
Exactly. So they've actually got TGA approval as a therapeutic treatment for sleep apnea as well. So this stuff is starting to come forth. And another system is the MyBrace system, which is from Australia, but are here in the US too. And that's a more kids-focused one. So it's MyFunctional Orthodontics, where we retrain the kids to breathe with a dental appliance. So they're basically taught to breathe through their nose. And then lo and behold, their jaw develops naturally. It's fascinating. But some kids will also need some expansion as well. So it is a very pieced together model. I would look for dentists, one that work in airway and sleep. So they'll have that branding on their website. So airway and sleep. They will talk about myofunctional therapy, which is basically like Pilates for the face. So which is reprogramming the tongue, the lips, the nasal breathing. So that should always be incorporated, understanding the facial and muscle structures of a jaw growth development. And then so the devices they can use are ALF, the DNA, there's the HomeoBlock, there's the BioBlock, which is the orthopedics. So there's a lot of names out there, but if they are talking about these titles, it means they've trained. So what dentists do is they'll go and train for a certain amount of time to understand these the research and these clinical protocols. and they've put it into their practice in a certain way. So they'll usually explain on their website. So check that. Make sure that they talk about sleep and airways. That's the most fundamental. That's the most basic one, and it's probably the most common too. So if a dentist understands that, they're going to know that you want this kind of approach. And so from there, and there's a big approach in terms of working with ENTs, with sleep physicians, even osteopaths for sacro.
Yeah. So the dentist I work with uses the ALF. She works directly with an osteopath. So when you go in and get an ALF adjustment, the osteopath is there to work, who kind of works closely with the dentist to determine what adjustment is necessary and how it's working. We do our tongue exercises as a family now. And, the way I found her was just through word of mouth. And then we interviewed some of her patients and talked to them about the results they'd had and how it was to work with her, which is a good way to do it. If you find someone that you like, ask them to speak with some of their patients. If they don't let you do that, that's kind of a red flag. But if they do, you can ask the patients what their experience has been like and, what benefits they've got, anything you should know about treatment and just, their thoughts in general about working with the dentist. That can be really helpful. I think there are people doing this kind of work in most major metropolitan areas in the US now. It may be harder to find if you're in a smaller town or something like that, but sometimes people will travel because the nature of the work is you often don't need, depending on the phase of the work you're in, adjustments could be as sporadic as every 2 or 3 months. It could be maybe monthly, but for some people, this can be such a game changer that it's actually worth traveling for, even if you don't have someone in your local place.
Absolutely. I actually get a lot of inquiries on my website about trying to find a practitioner. So next year, we're going to look together to have a complete directory of practitioners and how they can find them. And there's also stuff they can do online a lot as well. So there is going to be access to this coming very, very soon. We are on the cusp of some big change. So keep your eyes out and make sure you just keep looking. Don't lose hope that there are practitioners out there that do this.
Yeah, and we'll provide some links in the show notes to some of the technologies that we've discussed, like the ALF and the DNA appliance, so you can learn more about them and maybe use that to start Googling for people in your local area. Steven, I want to talk about a couple other things before we finish up. One is standard orthodontics. A lot of parents are facing the decision, about whether to get braces for their children. They've been told that they need them by the orthodontist that they've seen. What would you say to those parents?
I would say if your orthodontist isn't talking about early intervention, so if they're talking about waiting or if they're talking about or they haven't even talked to you about any kind of breathing or functional, I would be looking for a second opinion. Now, what we're seeing now is the preventative orthodontic model, which is one where we're getting much, much earlier. So the first dental check should happen straight after the child is born. And so what this actually talks to is that midwives used to have a sharp nail on their pinky finger, and they used to check the tongue of the child. So at the first dental check, and if there was a tongue tie under the tongue, they would cut it with their sharp nail. Now, tongue ties, which is a flap of skin that is actually left over when craniofacial development is incomplete, can lead to many, many problems, and it's been linked in the literature to it just slows down jaw growth, so it increases your risk of crooked teeth. So that's the first check that every parent should be. It's the simplest. You are your own orthodontist. The things that you're watching your child do every day is far more important than what an orthodontist can do when you go to them later on when the problem's already occurred. And then so if there is a tongue tie, so breastfeeding is then the real kind of the first catalyst of how we begin that jaw growth. So the child breastfeeding is this amazing synergy of craniofacial growth. The child has to push the nipple to the roof of their palate, which is soft like wax in those early months. And so that pressure actually expands out the maxilla, but it also teaches them to breathe through the nose. And then the tongue is activated. So the tongue actually sits and actually connects to the base of the skull, the hyoid bone, the mandible. So it's holding the airways open. And we need to learn to posture to hold those. That's why your tongue exercise is so important, because you're learning to hold your airways open. And actually, interesting, the studies on Indigenous Australians with the Australian didgeridoo, that we can actually improve sleep apnea, and had positive results on sleep apnea when we use the airways and exercise our airways. So breastfeeding is the first step of this craniofacial growth. And what that is showing us now is that every meal your child is having is developing its jaw. And so you should be thinking this way, that what are you feeding your child to help this process happen? And so from there, as the child gets its deciduous teeth or its kid's teeth, often we don't see crooked teeth in those early stages, but you can spot the signs that things are going wrong. So look at the palate. See, is their palate high? Do they breathe through their nose? Do they, when they're watching television, is their mouth open? Kids should never breathe through their mouth. We need to teach them to breathe through their nose. Their tongue posture, all of these things we can be looking at every day. It's so important for parents to know this, and you're influencing craniofacial growth. And then so as the child reaches 6, and then we're starting to go into the next stages of development, and so we're starting to lose teeth then we're starting to get where we need to kind of make sure that the jaws are going towards a good trajectory for the adult dentition to come in. So all of these factors will come into play. And so one thing that I really hammer home in the book and also in my practice is that vitamin D is crucial. They should be checking their child's vitamin D levels religiously through these processes, just because it's such a fundamental sign of all these things and developmental processes happening well.
And would you say that if a kid is a teenager or, a preteen and they're facing braces, that working with a device like the ALF or the DNA appliance can, in some cases, avert the need for braces, or are they complementary processes?
So braces are kind of like the finishing. So sometimes, so I've worked with John and Mike Mew in the UK. They really don't. They said we don't even look at the teeth. We're looking at the jaw. But so braces they're a nice. Once you do the expansion, once you get the foundations of the house right, you can bring the nice furniture and put the braces on. That's fine. But as long as we know that there's no breathing issue, that the sleep's fine, their function's fine, then you can pull the teeth into line. Then that's okay. And so what these new systems are doing is that it's making sure it's testing all the sleep parameters and making sure that growth and function is properly developed or functioning in as best as it can. And then you can put braces on. That's fine. But as long as we see braces as that last real superficial aspect of the dental arch development, that's where we're going to go with braces. It will not be the first step. It will be the last, if we do want that cosmetic change in the teeth. And because there will be more space, for instance, when you expand the maxilla, sometimes you have to align. It doesn't happen the same in everyone. So there are different ways and systems you can do. You can do it with invisible braces, for instance. But it should be very much seen as the last step. So for parents, you should be trying to get in much, much earlier.
It's kind of like taking a drug for diabetes before you make diet changes.
Yes, absolutely. That doesn't make any sense, does it?
No, not at all. And not to say that if you make the diet changes and blood sugar is still low, there is a role probably for or blood sugar is still really high. There can be a role for medication if you're not able to manage it completely. So, it's just definitely something to think about and consider. And, like Steven said, get a second opinion if your orthodontist isn't looking at things from this perspective. Cause you're going to spend a ton of money on braces and orthodontics. And if that ends up causing more problems than it solves, that's of course unfortunate. Your book that's coming out today, actually, congratulations on that, is called The Dental Diet. So we started the conversation off by talking about the contribution of food and diet to dental health and why that's, so obvious, but often overlooked, and how that impacts the rest of the body. So let's finish up by talking a little bit about how changeable is this stuff. If a kid is born with, poor dental health, poor teeth, maybe the parents weren't aware of this stuff, they weren't making the right decisions about it, how can the dental diet help? Is it too late? Can it actually make a difference? Can it make a difference as they grow up in terms of the structure of their jaw and their general health and well-being? So, what have you seen in your practice if you start working with a child and his or her family and they start to implement this nutrient-dense diet? What's possible? What are you seeing in your patients?
Yeah, I mean, the implications for the growth factors that we've talked about is profound, because the reason why fat-soluble vitamins grow straight teeth is because they send deep hormonal and bone homeostasis signals through the body. So vitamin A, D, and K2 all have this beautiful synergy to make sure bone is mineralizing properly. And that's so obvious in terms of we know how that can stunt jaw growth. But it also connects to the growth hormone, insulin-like growth factor. So when you correct these things, the growth hormone factors are corrected in the child as well. But the other thing is that the sex hormones and their hormonal signals are changing as well. So testosterone is known to connect to jaw growth, but it's also connected to levels of fat-soluble vitamins. So vitamin D, K2 is linked to, obviously, to testosterone release in the testes. And so we have kids now that have these kind of hormonal and thyroid issues, but at the base of it, their bones aren't growing well because we don't have enough of these nutrients. So we see this amazing change in how their body is starting to balance out. But one thing that I really missed, in dental school is that, each tooth has an immune system. We have osteoimmune cells inside our tooth in the dental pulp called odontoblasts that are hungry for fat-soluble nutrients. And so vitamin A and vitamin D activate these odontoblasts, but they actually release proteins that are activated by vitamin K2. And so that stimulates an immune response inside your teeth, making you immune to tooth decay. So, and these are the systems that were ancestrally always treasured because it made sure that our dental health was in line. So kids are then not having the rates of tooth decay that they're having, but then on the other side of it, the mouth and the oral microbiome, which the immune system is protecting them against, is translating straight to the gut. They're swallowing thousands of bacteria every day, and all of a sudden their digestive system is starting to balance out. So all of these factors are all happening in the mouth, but all reverberate right throughout the body. And so once you manage and once you simply set the diet so that they are eating for these nutrient-dense, fat-soluble vitamins, then everything else comes into play. It's a beautiful way to see, the health change of a child, but also right throughout life. All of these processes are happening every moment, every day. It's quite remarkable.
Well, Steven, this has been fantastic. I wanted to discuss this on my show for some time, so it was really serendipitous that we connected at PaleoFX and that you've written this really important book. It's called The Dental Diet. It is available today in the US, the UK, Australia, and Germany. I think it has been quite frankly, a missing piece in the functional approach to health and wellness. It, for some people, can be that thing that is preventing progress from occurring. And I've certainly seen that to be true in some of my patients. We do the whole functional medicine thing and, we run all the tests, we treat, and they're not responding. And then I refer them out for dental orthopedics or functional orthodontics. And that then is the linchpin, so to speak. It's the thing that then allows everything else to work the way it was supposed to work. So establishing the connection between diet and dental health is absolutely crucial, and your book does a fantastic job of that. And I love how it just ties the health of the mouth to the health and the jaw and the structure of the face to the health of the body in a really clear and accessible way. So I think it's an important book, and I really highly recommend everybody go pick up a copy of it, and especially if you have kids. It's absolutely mandatory information for parents to have. So Steven, thanks for joining us again. And where can people find out more about your work and, follow what you're up to?
Yeah, so they can jump on my website at drstevenlin.com, so drstevenlin.com, and on social media at Dr. Steven Lin. And so, we cover a lot of functional oral health topics on there, like the oral microbiome, the mouth-body connection, sleep. But Chris, I really have to thank you for all the work you've done, because, during my process of, waking up from my conventional dentist hat, finding people like you that were actually getting to the root cause and thinking ancestrally was crucial. It was a crucial piece of the puzzle. So I really have to send out my gratitude for that. And I really agree that, the functional medicine progress we're seeing really needs to take a next step, and that the functional dental, this whole perspective of seeing the whole body, the mouth is part of the body after all, and that it all comes together in this beautiful synergy. When we eat for dental health, when we understand the function of the mouth, it all comes together in this beautiful synergy. So I'm really excited for what we're going to see in the next years.
Absolutely. Well, thanks again, and I'm sure I'll see you in Austin in April.
Amazing. Looking forward to it, Chris.
All right, take care. That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresserlac. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.